patient today asked about OCD, or Obsessive Compulsive Disorder, and wanted to know a little bit about what are compulsions. As mentioned previously, an obsession, which can be part of OCD, is when someone has a repetitive thought or image that comes into their mind that may really bother them because it may be strange or inappropriate or offensive in some way, but yet they can't shake that thought. That thought continues to repeat kind of over and over again, like a broken record, for example, and cause that person distress. Well, a compulsion is when someone feels the need to do something, typically to try to put that obsessive thought to bay. An example would be, let's say that someone has the concern, they have an obsessive thought that something bad might really happen to their family. And then they develop the compulsion that, well, what if every morning I kneel and I pray for exactly 30 seconds, and I say 2 Hail Marys and an Our Father, that then nothing will happen to the family. So that would be a compulsion to do something very specific that needs to feel just right in order to prevent the obsessive thought from happening. Different examples, people might feel that they need to touch things a certain way, count things a certain way, arrange things a certain way. Someone might say, you know, if during the day I kind of brush my one shoulder, then I'll feel like I need to brush the other one to have some type of symmetry or balance with the way that I touch my shoulder. And then if I feel like I didn't do it just right, then I might need to go back and touch this shoulder and then the same thing to this one again until it feels just right. Or someone might say, you know, I feel like every morning I need to put on my socks and then my boxers and then put on my shirt this certain way, or I need to wash myself in the shower in a certain order. And individuals will actually get stuck sometimes doing these compulsions. When I ask patients about obsessive compulsive disorder, I'll actually say, how many hours a day do you get stuck thinking about these obsessive thoughts or engaged in compulsions? And someone might say, I spend 2 or 3 or 5 or 10 hours a day dealing with my OCD. So this obviously can be an extremely distressing illness. It is a treatable medical illness, and having OCD is something that no one should be embarrassed or ashamed about. But I do know that if you have these difficulties, you want to talk to a medical professional and get the help that you need.